Good morning. Let's start. My group is May up first and introduction to skill sets that expansion introduce ACD and gene disorder that affects hemoglobin production, leading to a formation of abnormal hemoglobin S. Spine of its mutants cause red blood cells to become reading and scale snare result in book and stretch and episode of cerebral pain as well as cause organ damage due to lack of oxygen. Conventional SCD treatments. Hydroxyurea. Describe how described Hamburg and K. Tratan CD and Mil and 1990 for SCG indirect ears role in preventive vaso-occlusion crisis. The Thai elimination of action of hydrolysis, such as a level of fetal hemoglobin HbF, will help prevent is cell-14 inhibition and ribonucleic reduce RR, reducing DNA synthesis in special cells. Also meeting how hydroxyl improves vasodilation by increasing the ability of nitric oxide. Consider effect and shelving of hydroxyurea. This could see the effect of hydroxyurea, which include neutropenia and bone marrow suppression and orphan symptoms such as anorexia, nausea, and vomit. Expression and controversy over its impact of fertility indicating that en el relation between hydrolysis and fertility might depend on factors such as dose and duration of the treatment. But still, it here how in hydrolysis names except for managed vasodilation increase the speed it channel. Blood transfusion in SCD. Spine-hop blood transfusions are critical for reducing mortality and mortality in variants con NCD. Mentioned they urgent in treating and preventing compression such as acute Chute syndromes and severe anemia. The potential completion such as anopterapy and roid absorbent and described strategies to mitigate such as use chersin and typical tumor in retention.
Blood transfusion. Blood transfusion are important intervention for reducing morbidity and morbidity in ECD patients, which more than 90%. 19, 1, 2, 3, 4, 5, 6, 7, 8, 9, 20, 19. Blood transfusion. Blood transfusion are important intervention for reducing morbidity and mortality in ECD patients, with more than 19 of ECD adults receiving at least one blood transfusion in their lifetime. Transfusion help treat of prevents the proprietary complication. acute chest syndrome and acute anemia associated with C is CD. However, blood transfusion can also cause side effects such as mutation and iron overload. New treatment. For more than 2 decades, hydroxyurea was the only FDA-approved drugs for CED treatment. However, since 2017, 3 new drugs have been approved by the Polector, crisanlumab, and L-glutamina. These new therapeutic treatments and associated mechanisms of action are discussed below, along with the only curative therapy currently available, metabolite stem cell transportation from the bone marrow. Volector. Volector approved by the FDA in 2019 for the treatment of sickle cell disease, and adults and pediatric patients belong to a class of therapeutic agents called hemoglobin polymerization inhibitor. This therapeutic work by changing the structure of function and abnormal hemoglobin, which the prevent formation of cycled RBCs. Recent clinical trials investigating the efficacy and safety proliferation of Volector in patients snowed increases in hemoglobin levels and decreases in laboratory market of hemolysis, indicating that Volector reduces disease severity. The most common side effects of Volector were headache, diarrhea, nausea, rash, and abdominal pain. In the figure, we can see how Volector selectively binds to hemoglobin and decreases its affinity for oxygen, keeping it in its oxygenated state and preventing cycling. Volector adds biselectivity and covalently binding to the N-terminal valine of the alpha globin chain in the hemoglobin molecules, modulating oxygen affinity. This action prevents desoxygenation and polymerization of abnormal hemoglobin, preventing the formation of cycline RBCs. Crizanlizumab. Crizanlizumab approved by the FDA in 2019 to reduce the frequency of vaso-occlusive events in adolescents and adults in an anti-P-selecting monoclonal antibody that's been P-selecting with high affinity, blocking interaction between P-selecting and ligands. Crizanlizumab is administered intravenously and blocks interaction between P-selectin and cycled RBCs and VBCs, maintaining microvascular flow dynamic. Figure 3, a schematic diagram of crizanlizumab binding to P-selectin, a protein expressed on activated endothelial cells and platelets, inhibiting the adhesion of the red blood cells to the blood vessel walls. This reduces the formation of vaso-occlusive clusters of singlet RBCs, improving blood flow and reducing the frequency of vaso-occlusive events and hospital visits in the sickle cell disease patients.
The glutamine is an amino acid essential for the synthesis of nicotinamine adenine dinucleotide, a crucial antioxidant for maintaining the red dot balance of red blood cells, interacting sickle cell anemia. L-glutamine is used to improve RBC resistant to oxidative stress, reduce hemolysis, and decrease vaso-occlusive crisis, although ineffective in reducing these events. But through studying for FDA approval showing no significant towards its hemoglobin hematocrit levels of reticulocyte count, suggesting that its benefits may not be directly related to reducing oxidative stress is RBCS. The cell transplantation is currently the only curation treatment available for stem cell anemia. It involves transferred red stem cell for a healthy donor to the recipient to replace their hematopoietic systems. This technique is especially beneficial for patients with severe disease complications. Down risks including graphic resection and graft versus hot disease. Limiting its use to patients with a need for treatment. Recent advances have improved HCT outcomes with optimizing image, leukocyte antigen compatible and used aploidant donor. HCT with HLA managed donor. Transplantation with HLA identified donor have shown its success and survival rate with overall survival rate of to 19%. However, fed patients have accepted to full compatible HLA donor, which has driven the development of motion unrelated donor when still fate changes such as rejection returns and prevalence. HCT with haploid donor. Stem cell transplantation with haploid donor. Some traditional associated with hinder rate of graft failure and GBHD. A significant improvement with T cells. Depletion, techniques, and additional supporting care. Recent advances make this approbation a viable option for severe cases. Proponents rather accept to curation transplanted. Future treatment. A continuation. Presuger is an oral medication that inhibits ADP mediated platelet activation and aggregation. Initially, it's showing promising results in reduction vaso-occlusive pain in sickle cell anemia patients. Later, SCAR clinic studies did not show significant decrease in painful events. Nevertheless, it rolled in treating toward complication reminded of clinic interaction. Mitapivat is an oral activator of pyruvate kinase. It erythrocyte used its cause of BQR, deficiency and research approach for treating exclude cell anemia after thalassemia. It improves hemoglobin concentration and reduces exclude hemoglobin polymerization. B. Lowering levels of 2, 3 glycerate in erythrocytes with increased hemoglobin, oxygen affinity, and reduction cell deformation.
Introduction to skill cell disease treatments. Sickle cell disease or SCD is a genetic disorder that affects the chain and function of red blood cells, leading to serious health complications. Traditional treatments like hydroxyurea have helped manage symptoms, but they don't address the disease root causes. Recently, new therapies like mitapivat and advanced gene editing techniques are showing promise in treating SCD more effectively and even offering potential cures. Let's explore how these treatments work. Mitapivat and hemoglobin stabilization. Mitapivat is a new drug that stabilizes a key enzyme in red blood cells by enhancing the stability of the enzyme. Mitapivat reduces levels of compound called TDPG. This reduction decreases hemoglobin polymerization within their improves oxygen transport in SCD patients. This combined effect suggests that mitapivat could be powerful tool in reducing symptoms and preventing complications. Gene therapy for SCD. Gene therapy offers a groundbreaking approach by directly correcting the genetic defect that causes SCD. In a recent study, an lentiviral vector was used to insert a handling hemoglobin gene into the stem cells of patients with severe SCD. The results were very positive. Patients showed an increase in normal hemoglobin and a reduction in skill cells. This shows that gene therapy could potentially cure SCD and significantly reduce its impact. Advanced gene editing techniques based prime edition. To advance gene editing techniques, base editing and prime editing makes possible to target and correct specific genetic errors without causing unintended DNA damage. Base editing can modify individual DNA basing precisely, while prime editing directly corrects DNA sequences with minimal risk of errors. Both methods offer a safer, more precise approach to gene therapy and represents a promising future for SCD treatments. Conclusion and future directions. In summary, treatments for SCD are advancing rapidly. Medication like hydroxyurea, bacilotor, and crizanlizumab have improved symptom management, while gene therapy and stem cell transplant offer hope for a cure. Also, these therapies are still in development. They bring us closer to effective long-term solution for SCD. Continuing research will be essential to making this option safer, more safe, and ultimately life-changing for ECD patients.